Hey everyone, this is nothing that is required by any means for y'all to watch, but I just wanted to give some information about Commotio Cordis. Um, this is something that we have recently seen a lot in the news because the NFL player Damar Hamlin is that collapsed on the field. He required resuscitation, defibrillation on the football field. This is what they ended up saying his diagnosis was. So you may have heard this term. You may not have heard it before all of this came out. You may or may not know how to recognize symptoms of it and how to treat it, like what you should do as a bystander. Living in Clyde, living in a small community, a lot of us are involved in activities outside of the school. We may have kids that we coach some of the youth sports, or we're involved in volunteering for youth sports, or you may or referee, or you may just be there watching a child, grandchild, niece, nephew, a family member, just being there supporting. Regardless, we may be in a situation that you may need to respond, and you could save a life in our community if this were to happen because you knew what to do. So I just felt like this was something that we needed a little bit more information on as a community. So what exactly is Commotio Cordis? So medically, it's described as a sudden arrhythmia and then cardiac arrest. And this is caused by a chest wall impact, like a low or mild chest wall impact. It's in people that have no cardiac history, no history of heart problems, no known structural defects or abnormalities with the heart. The arrhythmia that you would go in with is called ventricular fibrillation. So VFib is another name. You may have heard that term. Basically, it's where the lower portion of your heart, the ventricles, are fibrillating. They're basically just kind of quivering, and they're doing this. So they're not pumping the blood. So if that continues, obviously your body, your vital organs are not going to get the blood that's carrying the oxygen to keep you alive. So immediate intervention is needed. Intervention being CPR, defibrillation. That's like super important. So what's crazy about Commotio Cordis is that most of the time it occurs in athletes that are ages 8 to 18, which is really young. That's probably the age of most of our kids here. Um, Usually it's athletes that are participating in sports with projectiles like baseball, softballs. We don't have a lot of hockey and lacrosse here, but hockey pucks, lacrosse balls, those also have higher incidences. Football generally is a lower incidence. Obviously, this happened during a football game, and it wasn't because of a ball hitting him. It was a hit that hit right in the right spot. So it can occur in football. Also, martial arts, karate, jiu-jitsu, all of those things, it can occur in that if a hit is taken to just the right area at the right time. So the projectile objects, let's say a baseball, for example, it can hit the athlete in the chest with low impact, but it actually is enough to cause the heart to enter that arrhythmia, VFib. The heart is like an electrical system, is the best way. And it sends electrical signals to different parts of the heart so it knows when to beat, when to let go, when to send oxygenated blood back out to our organs, and when to take in the deoxygenated blood. So all of this saying, without immediate CPR and defibrillation, which is an AED or shocking somebody, VFib is most likely fatal. Okay. With Commotio Cordis, there is a really low survival rate if defibrillation or shocking with the AED occurs. Sorry, I'm trying to figure out how to word this. So it's a very low survival rate. So basically, if resuscitation, defibrillation occurs within 3 minutes of the VFib onset, the survival rate is 25%, which is still fairly low. It's not a great survival rate. But when resuscitation was prolonged and started after 3 minutes or lasted longer than 3 minutes after VFib started, that survival rates dropped to 3%. it is not likely that EMT or medical personnel would arrive on a scene within 3 minutes of being called, especially in a rural area. So that's why it is so important that as bystanders, we know what to do. We know how to step in and how to treat this when you could save somebody. Um, I said that the majority of cases are 8 to 18. Obviously, this NFL player was a little bit older than that. There are very few cases that have been found in people over 20, but it can happen. Um, Children are at a higher risk, and it's thought because they have a thinner chest wall, it hasn't developed as well as an adult. 95% of cases of Commotio cordis are males. This may be attributable to male youth. There may be more male youth that play sports that has projectiles, but it does happen. 95% of cases are males. Um, when you think about Commotio cordis, so Commotio cordis does not occur from injuries to the heart. You would think something like this in your head, you may think, oh, it's because their heart is injured, but that's not the case. Actually, the object, whatever the object is, baseball, like we said, we're going to use that for an example. It strikes the chest at just the right angle during just the right moment during the heartbeat. That part during the heartbeat it's during ventricular repolarization. And if you're looking at an EKG, it's during the peak of the T wave, if you're familiar with that. So really, Commotio cordis is something that happens with small, dense object. It has to be timing of the impact and the impact in just the right place. So you can see why it's rare, but that it can happen. When we talk about the low to mild chest wall impact, one of the articles that I read talked about 30 to 40 miles per hour. And so I think back, my youngest child was in machine pitch baseball last year. Well, we had it set at 40 miles an hour. So that was my thought that, I can understand why like younger kids are involved because, we're throwing the balls at them through a machine at that speed, or they're hit when they go and hit it. It's probably about that speed. So that's just kind of something to keep in mind, that's 30 to 40 miles an hour is kind of that range for Commotio cordis to happen. So timing of impact, that refers to the time that the baseball or other object hits the chest during the cardiac cycle, so during your heartbeat. So the heart is the most vulnerable when it is struck at the beginning of the T wave. And you can see this picture down here at the bottom right. It has all these letters, and you may or may not know what they mean. For medical people or people that are familiar, these have letters because it is telling us when you look at an EKG, all these different parts mean different things in the heart. When the heart, like I said before, is pumping, refilling, things like that. So that vulnerable window is right there at the beginning of the T wave. So that's when the ventricles, the bottom part of the heart, is repolarizing. Okay, so you can see when VFib occurs, when the ventricular fibrillation occurs, that bottom part of the heart is just twitching instead of pumping. You can kind of see that video I have there. It's kind of what it's doing, but quivering is a good way. Fibrillating is what it's doing. So it's not pumping. Okay. So that oxygenated blood is not being sent to where we want it to be sent. So if you've heard the term defibrillation, that is shocking using an AED. So if a heart is in fibrillation, it's fibrillating, you want to defibrillate it. So basically what an AED does, and if you've taken CPR with me, I know we've talked about this. If not, so a lot of people think that if you are flatlining and there's no heartbeat at all, that's when you shock somebody. That's actually not true. There's a couple of different rhythms you shock somebody, which we won't go into all of that, but ventricular fibrillation is one of those, because what the idea is when you shock somebody, when you defibrillate somebody, you're actually stopping the heart for like a minute of a second. And then hopefully when it resets or restarts, that it goes back into a normal rhythm. I like to think about it like if you're having computer issues, kind of the first thing we do if your computer or phone or something is acting weird, you restart it. And that's kind of what we're doing with the heart. The heart, like I said before, is it's made of like an electrical system. And so stopping it for like a millisecond and then letting it restart, we hope it goes back into a normal rhythm. But that's what defibrillation is, or an AED, or shocking. Okay. So without defibrillation, whether it's manually, like with the AED when you shock somebody, or there are certain medications that can be given in the hospital setting through IVs that are meds that are basically doing that, stopping your heart, resetting it. Cardiac arrest will ensue. Okay. Um, VFib is fatal if not taken care of. You will not get the oxygen that you need. So this is just another picture I really liked. It's kind of just another illustration, kind of show exactly what it's happening, where that impact occurs and the timing it occurs, and then you go into the VFib. So we've talked about different sports. I told y'all that mainly it's most prevalent in baseball. And you can see this chart here. About 61% of Commotio Cordis cases have occurred in baseball settings. The pie chart on the left, it breaks it down to baseball, softball, hockey pucks, lacrosse, cricket, soccer, hockey stick. The yellow is tennis balls filled with coins. That's actually sort of probably baseball too, because it's used by baseball pitchers for practice. So if you look on the chart on the right, though, it talks about the dark red on the top is sudden deaths by ages. So less than 10, more than 50%. Looks about 55% of occurrences, sudden death happened. Um, and there's very few survivors. That light pink is the survivor. And then the next age group is 11 to 15, then 16 to 20, 21 to 25, and greater than 26. So we can see how that chest wall, that thinning of that chest wall does affect by just looking at these ages. So less than 10 years of age, there's about 50 or about 60 events. Sudden deaths, 55 out of those. I'm sorry, not the percentage. 55 out of the 60 Commotio Cordis events ended in sudden death. And the blue and green, you can see below that. The blue are when they were competing in competitive sports, and the green was recreational. So you can see baseball there. Um, there are some recreational sports, and that may just be, out in the field practicing together, hanging out, just buddies playing. But then you have the competitive sports, and it's quite a bit. And that number probably is higher because we do have things like machines, and the pitchers are probably pitching harder. So the balls hit differently, things like that. Softball is the same. And actually, hockey and karate are the only ones that don't have like recreational on there. They're all competitive, but those are good numbers to look at. You can see football on there, pretty low incidence compared to baseball. So what do you look for if you are watching a baseball game? And what do you look for Commotio Cordis? So you are going to be watching for that athlete, that kid that was maybe hit in the chest by an object with like the baseball or softball. And you won't see any trauma. And when I say trauma, I mean like hemorrhaging. You won't see something stuck in their chest or their leg or a big cut. Like nothing on the outside looks like trauma. Usually right after it happens, the athlete will kind of stumble forward for just a few seconds, then all of a sudden drop and go unconscious. Um, if you're the one responding, that part will be followed with no pulse and no breathing. So even though when you're in VFib, that heart is fibrillating, like I said, it's quivering, you won't have a pulse because it's not pumping. And that's what the pulse is whenever your heartbeat, when it's squeezing, it's actually pumping. That's the pulse that you feel on somebody. So if they're in VFib, you won't feel anything. If you have an AED and you put it on them, the AED will probably say that they are in ventricular fibrillation. That's what it will be identified as. And you can see this picture on here. That is a picture of an EKG of VFib. You can see that there's kind of no rhyme or rhythm. It doesn't look like a normal EKG. And so if there's a screen, it may look like that, but the AED will indicate ventricular fibrillation. So what can you do to treat Commotio Cordis? So if you, like I said, you call the ambulance, it is very unlikely that they're going to be there within 3 minutes. And if you know what to do, even if you're not a medical person, you know what to do, you can help save a life. So the number one thing you can do is use an AED and defibrillate as quickly as possible. Okay. Using the AED is the best practice, and it gives that athlete the greatest chance of survival. If you don't have an AED ready, or if somebody is going to get an AED, you start CPR and tell somebody to call 911. So you want to immediately activate EMS, which is having someone call 911. And as you're doing CPR, if there's more than one person standing there, which most likely there is at a sporting event, you start CPR. You don't stop CPR to call 911. You tell somebody, call 911. You get the AED if there's one available. If it's in a school setting, we're going to activate the emergency action plan. So you're going to continue AED use and CPR until EMS arrives and takes over. If you've never taken CPR and you're interested in taking it, just let me know, and I'd be happy to teach it and go over it with you. And in my CPR class, we talk about with the AED, where to put the pads, all of that. Okay, y'all, sorry if I repeat myself, kind of doing this between students here, but with an AED, you have the pads on, and you learn this in CPR. You don't take the pads off. So if it delivers a shock, you're going to go ahead and continue CPR, and the machine will tell you. Just don't turn it off. It will tell you when it's time to do another shock or what you need to do. So it's pretty smart. Tells you exactly what to do, walks you through it. The pads actually have pictures on them, so it shows you exactly where to put them. So pretty easy. And this is just a little fact here. For every 1 minute delay in getting shocked by the AED, there's a 10% decline in survival rate. I thought that was pretty interesting too. So, we've learned all about this. Or is there anything that we can do to prevent Commotio Cordis? So we want to have an athletic trainer, a medically trained person at all sporting events when possible. And we have an awesome athletic trainer, Ashley, who is at most events, but if she's not, fortunately, our coaches are trained in CPR, know what to do as well. We want to educate parents, coaches, and other athletes on how to perform CPR and how to use an AED. We also want parents, coaches, athletes to know signs of Commotio Cordis, like we've talked about today. You want to have an AED near playing fields at all times, and make sure that the coaches know where the AED is located. So in the school, we have that. Our coaches know where they're located. They're all trained in it. Now, I will tell you, just kind of on a side note, in the community, I am working with our baseball board and softball board on getting AEDs out at those fields for our youth. It's not school related at all, but hopefully we can get that taken care of so that's available if we ever need it. And you want to ensure that any protective equipment that the athletes are wearing is fitted properly. For an example, in baseball, a catcher, you want to make sure that catching gear is fit properly, so that it'll help them be safe. And just a note on that, there has been some research on if there's like chest shields, protective shields, if our younger players wore that on the baseball field, if that helps. And it really has not been shown to be effective in preventing Commotio Cordis. So just a little side note there. Other things we can do as parents and as like youth coaches, bystander, anything like that, is teaching our athletes how to avoid being hit in the chest during sports like baseball. There are different things that the coaches can teach them. And I know that I've seen our coaches and they're really good about that. But that's just kind of something as a parent you can kind of keep in the back of your head too. And you want to make sure during baseball, softball, that you're using safety baseballs or baseballs that are the appropriate size for the age. You don't want to use any of these like really hard baseballs for a young group. So, guys, that's about it. Thanks for sticking with me here. I just felt like it was something that we needed to know a little bit more about and educate ourselves about. If you have any questions, reach out to me, whether it's as a school employee, a community member, parent, grandparent, aunt, uncle, whatever. I'm happy to help you. If you have questions about where AEDs are, how to use an AED, or you want to get CPR certified, just reach out to me and I'm happy to help. Thanks, y'all.